All right, welcome back to Live at 9. It is Wellness Wednesday, and today we do have a difficult topic for many women, and that's postpartum depression. It's a mood disorder that can develop after childbirth. Today we have Dr. Quinn with us to discuss how to help women with this disorder. Good morning, Dr. Quinn.
Good morning.
So, Dr. Quinn, what is postpartum depression?
Well, as you said, it's a mood disorder that's given to women that have just given birth within the first 12 months that display certain symptoms to include fatigue, just overall sadness, maybe crying spells, the inability to bond with their child, and or even exacerbations, which we hope to avoid. But what we really want to do today is help the community, our viewing audience, understand that it's not anything to be ashamed of.
Right.
It's a real psychological diagnosis. Like cancer is a medical diagnosis. And an individual with cancer shouldn't be ashamed. But like all diagnoses, the earlier you are identified, the earlier treatment is initiated, the better the outcome in the majority of cases. So that this woman that's suffering this problem doesn't have to go into the exacerbations, which could be suicidal or homicidal ideation, or possible hallucinations, where I read reports where women were driving their cars and they would hear voices asking them to run off the road with their children in the car. And we don't want to get to this point, and we hope that will help women understand that it's better to just let people know what's going on, and also the people around the woman to ask questions. Are you okay? And it's okay to get help.
Yes, absolutely, Dr. Quinn. And you kind of touched on what happens and how dangerous it can be if you don't get help as soon as possible. What is the best way that they can get help? Maybe they don't know where to start.
Well, the best way to get help is, when I did my literature search, the number one reason women are not getting help with this diagnosis is they're ashamed. They feel like they're a bad person. They're not bonding with their child. Everybody is saying, why are you not happy? And they just don't even elaborate what's really going on. And what we hope is people can understand that it's not a choice. It's basically, for that individual, a complication of her childbirth or of her pregnancy. And once we start helping the community understand that it's not something that's a choice, then they'll be more likely to get the help, which can result in counseling and or medication, which can be tremendously helpful if it's initiated early.
Absolutely, Dr. Quinn. I think that's a big step that you mentioned, is really educating the public and the people, and especially the circle of people surrounding the new moms out there, that it's important to let them know it's okay if you're going through this. It's not your fault, and it's nothing to be ashamed of. So our first step is really getting rid of that negative stigma around not only postpartum depression, but all types of psychological disorders, including general depression as well. So you mentioned a little bit about the treatment. Is there anything else, though, that treatment, what it looks like for this disorder?
Well, it depends on the person's severity of their symptoms and where they are in the progress of their disease process. And I want to note that Mississippi ranks in the highest every year as far as people that are suffering from this problem. And according to the research, is citing that Mississippi has the higher ranking because we have more of a problem with our social economic status. More people have financial challenges, relationship challenges, occupational challenges, and access to health care. But we as Mississippians, we want to be more educated so that we can come down as far as the rankings of incidents of people suffering from this and save a lot of lives.
Absolutely, Dr. Quinn.